visual loss is there. The overall reported incidence is 0.9 to 17%. The open globe injury endophthalmitis is worse because there are a mixed type of organism that depends upon all location where the and settings where the injury occurred. So plus we have to see the comorbidities of the trauma itself. The incubation location is also very important. So which are factors they are customized according to factors. We need to customize the management plan for the cases. So type of the wound, whether it is a penetrating or globe rupture or regular, irregular, sharper wound, object of injury that carries the organism, setting of injury. Many of the time of history we can tell the when we ask the history, patient may be able to tell, and we may find some complex organisms. IOFB small and large, and there are lens abscess, intravitreal interval between injury and presentation, that is important. Management plan, the wound closure is a primary requirement. Along with wound closure, intravitreal antibiotic injection is very important with that. Removal of foreign body if any. Presenting vision, according to that we have to take into the account. And management of entry segment. Securing infusion in the vitreous cavity is very vital. So when it is open globe injury rupture, we find that even next day of the repair we found the patient with the endophthalmitis, and we need to do a full case with the endophthalmitis that ended up. This open globe injury may cause the lens abscess, maybe infiltration is seen in the lens, but we cannot consider because these all infiltration will also be present into the vitreous cavity. When we open then we realize. So this is the case where we had a penetrating injury, and managing the anterior segment. Only this much was exudates were there, and posterior segment was very clear. And this is the case which had a globe rupture, and anterior chamber maintainer was very useful tool to tackle this, because we are not sure about the even position of the deep longer infusion cannula. So these patients usually, if once the things are there and if they are responding to antibiotics and inflammation, initially started with the AC maintainer, and then later on infusion cannula was secured. This is also a globe rupture, but it was a lens abscess. We thought that only anterior part of the lens abscess was involved, but after removing we could find that it was a full-fledged endophthalmitis, and we had to perform full vitrectomy, and after cataract patient regained good vision. This is again a patient. We had to remove the anterior segment membrane, then we could find the posterior segment inflammation. We have done full vitrectomy, and patient regained good visual outcome. This is another case of open globe injury. We always thought of a lens abscess. We had to. Patient was taken for the traumatic cataract surgery. After the removal of the lens, we found that there are a lot of infiltration in posterior segments. After this, a large amount of exudates were found. So this is the case, 7 years old female. She presented with the no perception of light, and after post injection, that was the picture. We finished the vitrectomy, did not find much of exudates in the vitreous cavity. At the end of 1 month, we have taken patient for the scleral fixated lens. This our special designed lens was used. It was scleral tuck lens, and this lens is used without glue or without suture, and which is self-sustaining lens. This sustained on the sclera, and this patient regained 6/12 vision at the end of 1 month. This is the intraocular foreign body. So uh, we did the study. A retrospective data analysis was done for open globe injury, and we have taken from 2008 to 22, and found out the result in our cohort was 111 cases, and we found significant improvement. And these are the demographics. Wooden stick was the most common cause of trauma. Globe rupture was most common injury, and 59.4% penetrating injury responsible for endophthalmitis. 11.7% regain more than 660 vision, and 35.7% regain 360. And corneal signs, activity during injury, globe rupture, type of intervention, pediatric patient, these are the significant impact on the outcome. So 5.16% was the incidence of endophthalmitis, and corneal condition was responsible mainly for not improvement in vision. Good debridement, subconjunctival and intravitreal antibiotic injection may delay or may prevent the endophthalmitis. This is our Ocular Trauma Society annual meeting to be held at Mahabalipuram, Chennai on 16-17 December. Thank you.